Hi guys, come along with me today. We are doing a full face of tox and we are also going to take you through all of the markings of these injections. So as you can see, I'm starting off with the frontalis. I'm having this patient raise up her forehead so I can see the movement that she has in her frontalis, but I'm also having her clench her teeth to make sure that I'm all the way lateral on that lateral border of that frontalis. This just prevents any spocking of the brow and makes sure that we get good diffusion from one border to the other border. So also I'm spreading my dots kind of nickel to dime size apart just to make sure that I have an idea of where I'm injecting, and so I know that the diffusion is going to be equal across the whole frontalis. The next muscle I'm targeting is the glabella complex. So as you can see, I'm having the patient make an angry face, and then I'm marking the procerus, which is that middle muscle, and then I'm marking those medial and lateral corrugators. So it's a 5-point injection all the way together. And now we're moving on to the crow's feet. As you can see, I'm having my patient smile really big to see where she creases for those crow's feet. She doesn't have a lot of crow's feet, so we're only doing 2 injections on each side. Now we're doing a brow lift. So the way I have my patient do that is I close their eyes as tight as possible and I mark where that muscle is pulling that brow. So the goal is that you're going to inject very superficially on that brow and it's going to relax that brow and lift up. We're also doing a lip flip. So as you can see, we're only staying on that upper top lip. And this injection is very superficial, and I like to do 4 injections across the top lip. One, because it's less injections for my patient and it's less painful, but also you're going to get great results with this. Now I'm moving on to masseters. I marked from the corner of the mouth to the tragus. I marked those anterior and posterior borders of that superficial masseter, and I'm injecting into this masseter multiple times because the patient's masseters are so strong. I don't want her to get a fish gill, so I'm going to make sure I really inject there multiple times to get good diffusion. And I'm also doing the deep masseters to make sure that my patient doesn't recruit any ear pain. So I am finding that deep masseter by rolling off of that zygomatic arch right there and finding that little pit right in front of the tragus for that deep masseter. I did lower face tox as well. We did DAOs and mentalis, but when it comes to injecting the frontalis, we're going to inject at a 45-degree angle and we're going to be about half needle depth. So as you can see, I'm working my way across that frontalis. If you need your patient to move their head towards you or reposition themselves, please instruct them to do so. What matters most is that you as an injector are most comfortable so that you are sure that you're doing a great job. So as you can see, I'm going from one lateral border to the other lateral border to just make sure I get a really good diffusion of this toxin. Next, we're going to inject the procerus, which is a 90-degree angle. It's straight in and it's just about full needle depth. This is a very deep muscle that lies on bone, so you really want to utilize that whole needle. When it comes to your medial and lateral corrugators, you really want to watch your depth here. Your medial corrugator should be about 3/4 needle depth and your lateral corrugator should be about half needle depth. That just prevents you from dropping the brow because that frontalis lays under that lateral corrugator. Here we are doing a brow lift. As I said before, it's very, very superficial. So I'm literally just inserting my bevel and it almost should bleb. Once again, I'm having my patient close her eyes as tight as possible so I can ensure that I am injecting where I'd like to go for the best result. Here we are injecting the crow's feet. I am making sure that we are going up and away from the eye always. So I'm having my patient look towards me and I am injecting up and parallel with her orbital rim. And I'm doing that on the other side as well. Make sure you're never injecting down towards the lower face or mid face just because there's a lot of smile muscles that run in there and we don't want to affect those. Here is the mentalis. Once again, this is a strong muscle that lays right on bone as well. So we are injecting this very deep and we're doing this to make sure that there's no orange peel or dimpling in the chin. Here we are with those DAOs, another superficial injection that I inject back towards the ear. This injection is very close to the mandible and that's the widest part of the muscle and that's why I inject so low. Some people inject a little bit higher up, but it's personal preference. Here I am injecting those masseters. Like I said, I'm injecting those masseters multiple times just because she has really strong masseters and I don't want her to get a fish gill. So we're injecting her multiple times on each side just for diffusion purposes. That deep masseter, I've rolled right off of that zygoma and I'm in that little pocket I'm having her clench her teeth, and if my finger is moving right there, see, you can see it, that means that she is having a strong reaction to her deep masseter, and that deep masseter is right under that finger. When you're inserting your needle for a deep masseter injection, you're always going up towards the tragus. So you're going parallel with that tragus and you're injecting deep up and away. Here is the masseter on the other side. We are doing 3-point injection again on this side just to get the diffusion. Again, finding that deep masseter here. I'm having her clench. My finger is very much popping out because her deep masseter is so strong, and I'm going up and away towards the tragus. Here is a lip flip. This lip flip is just a 4-point injection on the top lip because that's what she needed. And as you can see, this injection is very superficial. That toxin is blebbing underneath the tissue is what you want. This is a very painful injection, so I always make sure that I try to do less injections if I can. Obviously, best results are important. Thanks for coming along.